Hi, it's Bernice Musselwhite back with patient J, and we are getting ready to start what would be the chest and the abdomen advanced assessment. So before I start, I will say that I believe I said cranial nerve 8 earlier when I was actually doing the glossopharyngeal nerve, which is the nerve 9. That's when I did the, or patient J said the ah, and we watched her uvula and soft palate rise. So that was cranial nerve 9. Cranial nerve 8 was hearing what we had assessed earlier with Weber's and Renee. And then also, I did not test. If you'll look at the camera for me real quick, this is the temporomandibular. Let me have just open, and is that hurt at all? You can keep opening and shutting. This is just for your wonderful. This is just her muscle, her just to see if it's tender, like TMJ, if you've heard of that. So we're just seeing how that feels, and hers is non-tender, which is expected. I also forgot the touch test, which I will be doing actually throughout this whole assessment. Her upper and lower body will do that as well as we go on. So now we're going to go ahead and go into the chest and the abdomen. I'll start first with the chest. So just for her to keep discreet, I'm just going to kind of look and let you kind of see that. Look at the skin. Her skin is fair and consistent. I don't see any, and the turgor is good. No signs of edema, no bruising, no lesions, no scarring. I do see neva, or nevi, how do you want to say it, just like little freckles that are on the top of her shoulders. Okay, let's look in the front. There, now I will open so that we don't make it uncomfortable for you. Okay, and then let me see. Here we go. Okay, so her chest, at least the anterior chest, posterior I saw better. Anterior, I can see partial. There, I'm sorry, thank you. There we go. Wonderful. Skin is even. It's symmetrical. I see no evidence of any bruising, scarring, not tender at all, no bumps. Wonderful. I'm going to go ahead and have you sit back up for just a second. So normally we would have done that sitting up, but just because I am trying to be discreet with her so that she doesn't have to reveal her body much on a camera to you, I'm just letting you see that I would normally have seen that just open for me to see. So right now I'm going to go ahead, I'll do anterior, and instead of just focusing on anterior and on exterior or posterior, I'm going to go ahead and do the fremitus on both, just so that I can go ahead and keep kind of in line with the way that my brain thinks, and then we'll go ahead and I'll focus on the front after I do the fremitus, because when I do my auscultation, then I'll do the front and then the back as well, and then do the palpation, and then we will listen for sounds. So right now, I want you to say 99 for me.
99.
Okay, and 99 again.
99.
Okay, 99.
99.
Okay, we'll come up here and 99.
99.
And I'm going to try to get up under here so if we can, 99.
99.
Okay, so what we're looking for is to see if we can feel a vibration, which I did, that would be expected to happen. From here though, I am going to need to use my stethoscope, and we're going to do some auscultating, and I'm going to listen to her lung sounds, and then I'm going to also do some more testing, and then we will go into palpation and when I can do her abdomen. So let me grab my stethoscope real quick. Okay, and here we go. So I'm going to listen to the front first, and then after I listen to the front sounds, I will listen to the posterior. So this is anterior, I will try and get where you can see and not be too much in your right. Oh, you're fine, thank you. So, breath in for me. Out. Wonderful. Okay, I'm gonna go below, sorry. Breathe in. And out. In. Out. Okay, and I'm going to come underneath. I can just come to the back. That's fine. Oops, sorry. Well, we're just going to make, maybe I can. Okay, and let me have you breathe in. Out. Oops, in. Out. And then I'm going to the side now. Breathe in. Out. Awesome. And in. Out. Okay, I'm going to repeat this now, posterior. If you start to feel like you're going to hyperventilate, let me know. I'm sorry. Thank you. You're doing good. Lucky for you, your lungs are all clear. But there's a couple more sounds here. In. And lovely. So even with the lateral sounds, her lungs are clear to auscultation. So very good for her. No crackles, wheezing, just clear breath sounds throughout. So the next thing that I'm going to do is ergophony. And ergophony is just to see, I will have the patient make the long E sound. And again, I don't know if I said in the beginning, but as with the last one, patient J has given us permission to do this video recording, so just to remind you. But I'm going to listen and also tape while she's making a long E sound for ergophony. So whenever you're ready, okay, start saying, when you feel me touch her back, then I want you to start saying E, like E. Okay, ready, go.
E, 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 E.
Good job.
E, E.
Wonderful, wonderful. And throughout all of this, I'm hearing the long E sound. What would be irregular is if you hear more of an A sound, but hers still remained the E. So the next thing I'm going to do is the bronchophony. I hope I'm not slaughtering that word, but that will be where I'm going to listen again to the lung fields, but we're going to have her say the word 99, and as she's saying that, I'm just listening to see if the sound gets lower or if the sound stays the same throughout. Sound staying the same throughout would be a little concern for me as we get lower. So whenever you feel me, touch it back again. Now we're going to do 99. Okay, you ready?
99,
Okay.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Wonderful. So it would be as expected to hear if we were oscillating for her. It's not something I'm worried about, that I could hear better the lower lungs. So the next thing that I'm going to be doing is listening to a whisper. And so I'll have her do the same 99 as we're whispering, and those sounds should be muffled. I should not be able to hear them clear, so I'm just listening to see if that's what I'm hearing or if I hear them clearly or at all. So we will try. So again, this time whisper 99 for me, if you will. Okay.
99, 99, 99, 99.
Definitely muffled.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99,
Wonderful. And again, that is as I would expect for it to be, with the sound of it just being kind of muffled with being crisper. So that is it for that auscultation. Next, I'm going to do some percussion, and I'm going to be percussing in the same areas I was listening to between the intercostal spaces, just to kind of hear if I hear the sound that I'm looking for, which I would hope is resonance. I'm going to sit this right here for a moment. Okay, and try and kind of do it where he can see. Okay. Sorry, come around here. Sorry, I don't want to get too. Come around. See if I can still do it through here. Yeah, it still works. Okay. And resonance it is. Okay, even there. There we go. Okay. And then if I wanted to do the back, we would just do the same, and I did hear resonance throughout for the percussion. So also you're palpating earlier whenever I was looking, but we're always touching as we go just to see if there's any tender spots or anything out of the ordinary that we need to be concerned about. And for her skin is normal. Everything has actually responded well for me so far. So the next thing that I'll have you do is we will lay back. Go. Here, make sure you have your sheet for you comfortably. Okay. Actually, let me get my stethoscope again. Thank you so much. Okay, so actually, will you kill me if I have you sit up and then lay back? So what we did earlier, the Prispera pectoriloqui, if I said it correctly, just so that I can give you the full definition name. I am very nervous, so forgive me. I know I'm probably going back and forth and maybe not keeping things completely cohesive, but I'm trying. So I'm going to go ahead and listen to our heart sounds sitting up, and then we will listen again laying down. When I do this, because I'm auscultating, I'm also going to do the bruits that we talked about earlier for her carotid that I didn't get to listen to. So I'm going to listen to those real quick before I start listening to her heart sounds. Okay, so using my bell. Okay. Wonderful, and nothing noted. So now I'm going to go ahead and listen to the heart sounds. I will be listening with my diaphragm first and then my bell second to see if I hear any bruits or S3 or S4, which are abnormal heart sounds that we don't necessarily want to hear. So I'm going to be doing first the atrial, and then I will be doing the pulmonary, then we'll go to Erb's point, and then tricuspid, and then mitral. So. There we go. Sorry. That's better. I was like, something's wrong. Okay, S1 and S2. But the S2 is louder. S1, S2 also, the S2 is louder. Now we're going down to Erb's point. Really sounds about the same. Okay. Now we see if I might be able to actually go over. Okay, so in tricuspid I'm hearing S1, S2, but actually S1 is louder. And then mitral, which is the fifth intercostal space, kind of midline clavicular. Also S1 is louder. So now I'm just going to listen again with my bell real quick. Good, strong heart rhythm, yay. I hear no murmurs, no abnormalities, no S3, no S4. Wonderful. Okay. So our heart sounds are all good. We are going to lay her back, and then I will listen again, and I will also be looking at her chest at this point too. Any heaves, I'll be palpating for thrills. We'll palpate over the same areas that we were actually listening to. So here we go again for that. Again. Okay, the aortic first, pulmonic, wonderful, Erb's point, yay, tricuspid, and mitral. Now, to find the point of maximum impulse, which is the PMI, that's going to be found in basically the same area as the mitral because it's the fifth intercostal space and it's kind of midline clavicular to the left. So I will go ahead and listen to that when I do. We call that the apical. So that's what I'm going to be testing right now, the apical pulse. We'll listen for 60 seconds to see what her apical heart rate is or her pulse. Sorry, am I pushing too hard? And I have 64 for her apical pulse, which would be expected for her. So wonderful. Now I'm going to pick on you just a little bit, so I'm going to be feeling and just looking. So I'm just going to pull down just a little bit. I'm looking over her chest, looking for any abnormal movements. And just, yeah, you can just lay your arms down and relax. I'm just going to pick on you. There we go. No rises. No heaves noted. Okay, so now I'm going to actually palpate in the same areas that I listened to. The aortic, the pulmonic, we'll go to the Erb's point, we'll do tricuspid and mitral. Not feeling any abnormal pulsations through, so I have no thrills that I was able to palpate. So the next thing that I will be doing is going into her abdomen. I'll be kind of looking at it, and here we have you covered up so you can be comfortable. There we go, keep you covered. So now we're just looking at her abdomen, all consistent in color as well. And I see I have one nevus and what looks like maybe a small abrasion. Other than that, the skin is completely smooth, dry. Turgor is good, no signs of edema. So, and her stomach is as would be expected. So it's soft, skin is not dry, and not diaphoretic. So I'm gonna go ahead and listen to bowel sounds real quick. And she has active bowel sounds in all 4 quadrants. While I have you actually laying, I'll kind of pull this down. I'm going to have you, I'm going to look, just because I have her already down, I'm going to go ahead and look at her jugular. And just, I'm going to have you turn your head to the left for me right there. And I'll lift you just a tiny bit more up, just fine. So there's no jugular vein distension. Wonderful. Oh, there, I'm more comfortable again, I'm sorry. So now I'm just going to palpate. So I'm going to be feeling her abdomen to see if there's anything unusual. We'll also palpate her liver, and I'll palpate her spleen, and then I'm going to percuss. So here we go. And this is to try and let you, I'll come around this way so hopefully you can see more. So we're going to palpate. Tell me if I hurt you at all, if there's any tender spots. Good. Okay, so on here, let's just go ahead and palpate. Forgive me, I'm gonna get up underneath there and get that liver so I can feel the edges of it. Okay, and then we're gonna come over here to your spleen. Sorry, I'm gonna get real close to you again. And feel that, make sure nothing feels in. It's not tender at all when I'm poking. Wonderful. Okay. I'm going to go ahead and I actually hear, sounds like timpani here, but some dullness here. Which could be expected because I bet you have to go to the bathroom. Thanks to me, yeah, sorry. I'm also gonna see if we can over the liver real quick. Also dull to sound. See if I can get this spleen that actually had a little more sound, so maybe more, that didn't sound as dull as the others. So we were able to percuss. And there was no tenderness or pain, but expected findings because, as she said, she does have to go to the bathroom. So this is all good for her abdomen. And then we've got her heart sounds. I'm trying to think if there's, okay, and I think that's all I've got in time for this video, so I'll cut it and we'll go right on to the next video. Sorry, sister.